So we have Heather Perkins, who is the hematology case manager at CHEO and president of the Canadian Association of Nurses in Hemophilia Care. And sorry, what? Past president. Apologies. Sorry. Oh, they passed the torch. Okay, sorry. Whoops. Heather is going to moderate a discussion on preserving the ability to identify bleeds and maintain infusion skills with Erica CRILLY, GILLIAN WILDE-FRIEL, I hope I said that right, who's a mother to a 10-year-old boy with hemophilia A from Ontario, and CLEAVEN PAGANI, who is a patient with hemophilia A from Alberta. So thank you all for being here.
Good morning. Thank you, Dr. Reimers. So I'd like to welcome our panel to the stage today. As you already heard, but I'll just reiterate that Cleveland has been living with hemophilia A. His treatment plan changed from IV prophylaxis to Hemlibra about a year ago. Gillian has a 10-year-old son named Aiden. He has also been on Hemlibra for about the same amount of time. He was also on IV factor replacement prior. And Erica, our NP at the BC Children's Hospital, and she's been there for 20 years, Erica. So obviously doing IV infusion and switches to Hemlibra also. So our topic today is preserving the ability to identify bleeds and maintaining infusion skills. Cleveland, I'll pose the first question to you because I think you would have the most experience with IV infusions. Do you feel it's an issue to maintain your IV skills, and what the importance of maintaining your IV skills is or is not, depending on what you feel?
Yeah, I feel it's very important, and I'll give you an example. So I was in Calgary, away from my home treatment center, on summer holidays with my family, and my kids decided to jump in the river and ride the rapids down. Normally, you do this in a boat, but it was a nice hot sunny day, and my kids said, well, you know, we've got life jackets, let's jump in there, other people are doing it. And I went, okay, well, as the kind of the protective father, I went, well, I guess I better go with you. So I jump in. Of course, I whack my leg on an underwater rock somewhere along the way because one of my kids got kind of scared, and anyway, I got injured. So then I went, well, okay, I'm not superhuman. I'm on Hemlibra now, but I still can bleed. So at that time, I went, okay, I don't want to go wait in the hospital and try to see what happens there. So I was fortunate enough to be packing some factor with me and decided to treat in that case. Another thing was that I was planning on doing a backcountry hike the next day, to be out in the wilderness for 4 days in Banff, away from any treatment centers at all. And those are the times I think that we need to keep up our infusion skills and be able to treat when we're not always right next to a treatment center where we can go. So yeah, I think it's super important. I have an example I can share as well. I mean, in the past, it was always, you get an injury, something happens, you treat. It was not a question, it was just you treat. Now, with this sort of wait and see approach, it's been a little bit odd and a little bit uncomfortable. So another experience I had was I was playing kickball with my kids at the park. And if you've ever been to Edmonton, our streets are full of potholes. And apparently, our baseball diamonds are also full of potholes. And so I go to run the bases on the first kick, and of course I step in a pothole, twist my ankle, and rolled it and went, oh, that really hurts, okay. Now what do I do? Normally I'd go home and treat. In this case now I go, well, I've been on Hemlibra for a while, maybe it's gonna get better. So I wait a couple of days, doesn't get better, waited a week, didn't get better, then went, I think it's time to treat now. I call my treatment center and they're like, yeah, why didn't you treat? So I learned my lesson there. I treated one treatment, got better, went, okay, now I know the limits. So we know when we're bleeding, but when do we treat? I think that still is a question, and the question was brought up this morning in the session, but it's different every time, and I think we still bleed and we still need to treat. So, yeah.
Thank you. Gillian, can I ask you, do you feel you could maintain the skills? But also, because Aiden's 10, I don't know where he was on his journey for learning himself. Is it possible for him to maintain his or whatever he has learned to date before he switched to Hemlibra?
So our situation is somewhat different in the sense that in addition to being Aiden's mom, I was also an emergency department nurse for 4 years. And so I personally had 4 years of experience in accessing veins. When Aiden was diagnosed with hemophilia, I had actually transitioned out of the bedside and into nursing leadership. So it had actually been 7 years since I had accessed veins and had never infused a child before. And so when I started infusing Aiden, because he was only infused peripherally, it was actually not very difficult to remember the skills that I had used previously, and that muscle memory came back fairly quickly. So I think from that perspective, certainly there's benefit to reminding yourself and practicing every now and then, but the skill does come back very quickly. But the other side to that, however, is that when I was doing IV infusions with Aiden, he was very adamant that we not switch veins, we not do anything that would actually cause the infusions to be painful. So we always access the same vein. He had enough scar tissue that it wasn't painful. And so we have not had to do factor infusions since he started on Hemlibra. But I suspect that he would be very upset with having to access a new vein again and the pain of no longer having scar tissue. In terms of Aiden himself, so he had attended hemophilia camp. That's where he had learned the skill of being able to self-infuse. I think he had learned when he was about 8 years old, and so he was able to start infusing independently and getting factor ready. And it was a bit hit or miss, but the skill was definitely building. If he were to have to do that today, I don't think at this point that he would know how to reconstitute, how to access the vein. I think he wouldn't be successful, and with the age that he is, he's not particularly patient when he comes to those types of things. So if it doesn't work, he would not be willing to try again. So I think that I could infuse him at this point in time, but I certainly don't think that he has the skill set to be able to do it himself. Especially because his veins are still smaller, and maybe if he was older with larger veins, that would be easier. But no, I don't think he could at this point.
Thank you. Erica, from a healthcare provider perspective, as our younger patients potentially go right to Hemlibra and never learn to infuse, what do you think our role is? I'm saying our because I'm a nurse. What do you think our role is in this? And do those patients need to learn to infuse to have that protection that Cleveland was talking about when traveling?
I mean, this is going to be where we're going to be adopting our care. And I've even seen within our clinic, there's some families that hated every second of ever having to give an IV infusion to their family member and don't ever want to do it again, and really happy to access the nurses or their local hospital for an IV infusion, and that's okay. We're not going to make them do something that they didn't want to do if they don't need to do it regularly anymore. And I think that that's been important for me to recognize. And I think in the new patient that maybe never acquires mastery in IV infusions, we're maybe going to be teaching them at a different juncture of their pediatric treatment. Like I think your example of your child who's 10, where we'd really be trying to teach him self-infusion maybe when he was 8, 9, 10, 11. Now we're able to shift that skill acquisition to 16, 17, 18 when they're starting to live on their own, or if there's need for regular infusions. I think that we also need to strengthen systems to be able to provide IV support for our patients that maybe don't have those skills. And then we also need to respect that some people do have mastery in IVs. If you've been doing your IVs regularly for 40 plus years, who cares if you haven't done one for a year? You're probably going to be just fine. And we need to respect that people still can home infuse and have access for them.
Thank you. And I'll ask any of the panel members, recognizing bleeds. So if you're on Hemlibra and you haven't had a bleed for a long time, will there be any, Cleveland, I think you spoke to maybe not treating a bleed as quickly as you should have, but did you know you had a bleed? Was there any difference in the recognition of it or anything like that?
For me, I know when I'm bleeding and when I'm not. I think it's more difficult in children when it's not yourself. I'll share one more example. I was repairing my bike just about a month ago, and I was just pumping up a tire like you normally do, and my hand slipped, and I whacked it on the brake rotor, and it swelled up right away, and I went, again, okay, normally I would just treat, but do I or do I not? And this wasn't a joint bleed, it was just a traumatic impact. I decided, well, let's see if this Hemlibra is going to work. And so I waited. It kept swelling up into the evening. I thought, well, I'll wait till the next morning, see what happens. And it calmed down and it healed. And I didn't have to take any factor in that case. So again, I think it's every situation is different. If it's a joint, it's different. If it's a traumatic impact or something like that, it's different. But it's those injuries that we ask ourselves every time. Should we be treating? Is this a bleed? Is this not a bleed? And do I need to treat it? And I don't have any magical answers for anybody except for my own experiences. So if you want to talk more about it after, come and find me.
Gillian, we have a couple of minutes left. Do you have any perspective on recognizing bleeds?
So I think certainly with Aiden only has had 2 bleeds. He was quite young. He did not know he was having them when he did, and they were muscle bleeds. And so we had a situation probably about a month ago where he was at school and was hit in the head by accident by someone and had a goose egg. And I was out of town. My husband doesn't infuse, and trying to determine whether or not he would need factor. We are very connected to our team, so we sent pictures and details, and they provided basic first aid at the school, and he was fine. But one of the things that's a bit difficult for me is, as a mother who is a carrier, and I myself have mild hemophilia, I have my own perception of what mild hemophilia is. However, my bleeding opportunities are different from my son's, and so it's a little bit difficult. Sometimes I think, well, is that something I would be worried about with me? But obviously his bleeds are going to present in slightly different ways, and so it makes it hard now for us to navigate what should we be concerned about and what should we not, so that we're still working on learning that piece.
Well, thank you very much, and thank you to our panelists for sharing your perspectives, your thoughts, and your experiences with switching over to Hemlibra.